Hello, everybody. Welcome to another edition of Community Conversations here on Facebook Live and WHBG Channel 20. I'm Mayor Eric Pappenfuss, and it's Friday at noon, so we are here live, and we've got a great panel of guests today, which I will tell you about in just a moment. I wanted to begin, though, by acknowledging the tragic death of Jacob Blake this past week in Kenosha, Wisconsin. Mr. Blake was shot 7 times in the back, and as you know, has been paralyzed. Those images went viral, were seen across the country, and I think they remind all of us why these conversations like we're about to have today are so important. We need to focus on programs that are working, on de-escalation training that is happening, and how we can all improve both our policing and our relations with the community at large. There was another video in Harrisburg that I was shown several times this week that caused a lot of concern on Facebook. Perhaps you all saw it as well. And it was a video of 2 Harrisburg police officers that had just made an arrest and basically were being yelled and screamed at and vilified by the community. And they just sort of sat there and took it all in. It was a difficult thing to watch, and I think in this current climate, it's become harder and harder for our police officers to do their job. And in that context, it should also be noted that last night we had an award ceremony for our police. It was a quiet, a private ceremony, really, for just them and their families, but we talked about some of the acts of heroism that have occurred over the past year, including awards of bravery for saving a small infant who was in danger of being thrown from a rooftop, to other acts of bravery in the community, saving people with Narcan who had overdosed or were in danger of dying, things that our police officers do on a daily basis. The point being that at no point in time have I ever seen forces more aligned here in central Pennsylvania to try and make a difference and bring about reforms and improve relations with community than I'm seeing today. The county, through programs like the co-responder program that we're about to talk to, is fully committed to crisis intervention training, and we're going to talk about what that is and what it means. Harrisburg City Council has been spending all summer working on establishing a new police review advisory board, and we'll talk about an update on that. And we've been busily updating things like the use of force policy for the city of Harrisburg, which is very progressive, but can always be better. That's been the 8 Can't Wait initiative, and we can talk about that, not just today, but in future shows as well, where we stand. So let me begin by introducing our guests. Just generally, we have the superintendent of the Harrisburg School District, Mr. Christopher Selmer. He's going to give us an update on back to school, which will start on Monday. And we have Dauphin County District Attorney Fran Chardo. He's here to talk about the co-responder program, and he's joined by Catherine Kilgore, who's the CJAB administrator for Dauphin County. And more close to home in Harrisburg, we're joined by Captain Dennis Sorensen and co-responder Liz Manning. And they're going to talk about what this program is doing on the ground here in Harrisburg very specifically. And of course, we have Councilwoman Public Safety Chair Asha Green, and she can update us on what City Council has been doing this summer and where we stand with that review board. So it's a great conversation, and we will have it in just a moment. In terms of a few general announcements, I wanted to say that we got the BioBot statistics for Harrisburg again this past week, and again I'll contextualize that and explain that BioBot is the wastewater treatment statistical reporting where they sample wastewater to determine the prevalence of the coronavirus in Harrisburg. And for the second week in a row, we were significantly under 5%. Specifically, the results for Harrisburg for this past week were 3.4% as a prevalence rate, which is a good sign. Again, that's now showing a sustained pattern on the graph of being at a low level under 5%, and it's the first sort of sustained pattern that we've seen, and the lowest we've been since all the way back when the testing started. We're not through the woods yet, certainly with coronavirus, but it is now a pattern of good results for the community, and I'm pleased to say that. Also, you might have seen, and perhaps you've seen in the Washington Post, I did, that BioBot is being used by colleges and campuses around the country as well to test wastewater as kids are going back to school. If you do have a college-age child who's gone off to school, you may have read that I think it's the University of Arizona and it's others that have been testing wastewater in dorms as a matter to determine if there is prevalence of the virus even before students are symptomatic or it begins to spread. And they've done that successfully now a couple of times where they've been able to then test particular dorms and quarantine individuals who are asymptomatic and stop the pandemic from spreading before it started. That's the same technology, the same testing technology that we in Capital Region Water are using for monitoring the virus prevalence in Harrisburg, BioBot. On a larger economic development note, I want to note that Restore Dauphin County is opening today, and this is a grant program which is being funded by the CARES Act, federal funds, and one of the eligible activities are eligible small businesses and nonprofits in Dauphin County that were negatively affected by COVID-19. This is yet another opportunity for small businesses to potentially apply for a grant. The window for those grants opened today. It opened this morning at 8 a.m. It's going through September 14th, and you can find out more about this program if you go to dauphincounty.org/cares, CARES for the CARES Act funding. I would encourage all businesses to look into this and apply. There are millions of dollars available for all of Dauphin County, and there's several trenches of funding, one of which is for small businesses and nonprofits, another of which is actually for municipalities. And the city of Harrisburg, among other municipalities in Dauphin County, have also applied for some of this funding, in part to help fund our public safety initiatives that have been ongoing throughout this entire pandemic. So more at dauphincounty.org/cares. Saturday Nights in the City is continuing, as you all know, through September, and we're rapidly coming upon Capona. We're going to have a show next week that'll talk a little bit about how we're going to celebrate Capona safely, much as we did at the 4th of July. Scaled back, only one day, but there will be fireworks and social distancing, and everyone's going to have a safe and good time. And I also wanted to just reflect for a brief moment on an amazing event that happened in Harrisburg this past week, and that was the dedication of the new African American monument on the Capitol grounds. It brought out the governor. It brought out all sorts of individuals. If you haven't had a chance to walk down Walnut Street across from the Irvis office building and the Capitol complex on the one side and Strawberry Square on the other, you will see a monument which is not yet complete, but which has been started, and there are several central figures there. And it's an extraordinary monument. It's a moving one, and it's going to become not only a talking point, but a destination for people as they come to visit. This is the first monument dedicated to African Americans on the Capitol grounds, and it is long overdue. And it's something really for Harrisburg to be very, very proud of. And the city and the county both helped fund that monument, and to see it come to fruition was a deeply moving and important event. And I believe it's going to be airing throughout on Channel 20, so you can see Moment's video of that. Hopefully catch it on replay if you haven't had a chance to see the monument yet in person. Also, City Council is back in session, and their meetings will continue virtually on Zoom, so continue to watch for those. There's going to be a lot of activity. We've started having budget meetings at the city. We're talking about all sorts of different initiatives, including affordable housing, policing reforms, and as you know, we're dealing with a pretty significant decline in revenues due to COVID-19. All this is coming together, and it should make for a very interesting year. We do have, happily, due to careful management in the city, a rainy day fund, a fund balance, which is going to allow us to make the types of investments that we want to make, even with revenues down. And you're going to see that budget document as a sense of our priorities and our collective wishes as city government, and is reflecting your wishes in the community as we move forward. I want to just start, before we get to the issue of public safety, with our superintendent, Christopher Selmer, who has joined us again. As watchers of the show know, we have already had a couple shows devoted to back to school, to the new community classrooms. Boy, the community classrooms initiative has been completely embraced by the community. We've had people come up to me constantly asking for information about that. And that website, again, is communityclassrooms.org. You can sign up to register your child to have a safe space to engage and go back to school if you have to work and can't have that type of setup within your own home. But let's talk about back to school, Mr. Superintendent. It's going to start here on Monday, and what should people expect?
Good afternoon. Again, Mayor, thanks for having me. So Monday is going to be like no other start of the school year, in history across the state and many school districts. So for us, obviously, we're 100% virtual. We are continuing to push out devices. We're distributing all this week. We weren't scheduled to distribute today, but we're still actually distributing right now as we discuss. So it is an all-out push. This week, we did a number of on-the-ground kindergarten registrations and other grade level registrations, as well as a night where on Tuesday night we were all out administratively as families could walk up, ask questions about what to expect for the first day of school. In addition, this week, our teachers have gone through an extensive professional development program this entire week to prepare them, because this is a completely different way of delivering instruction. And so we needed to certainly spend time supporting them. But certainly, to be very forthright, there's a lot of nervousness yet going into Monday. We're excited, but at the same time, this is something that's very, very different. And so in that regard, next week, we're also going to be outside the buildings Monday through Thursday. So if students for some reason still need a device, if they still have questions, if they need support, we will be out at all the buildings Monday through Thursday to help support our families and community as we make this transition. But certainly it's going to, we need to work together. We need to be patient and understanding of each other and really work through this first week or two to successfully get up and running for the start of the school year.
Absolutely. It's a big change. It's going to affect a lot of people. And understandably, there's a lot of anxiety and just the normal stress that occurs compounded with the start of the school year. Can you tell me what are some of the most common questions that you've been getting from members of the community and parents about the start of school?
I would say too, we have option A, which is our pathway to classroom instruction. We have option B, which is our Harrisburg Virtual Learning Academy. So what's been happening over the past 2 weeks is there's been shifting from our HVLA platform back to our pathway to classroom instruction. As parents and as we've been able to meet and discuss more about what the options mean for families, we've been able, I think, to better fit families with the option that hopefully best fits their situation. HVLA is an asynchronous program. It's more self-guided. There's more flexibility, though, for families. So for some families who will be supporting their learners, having that ability to be on later in the evening, as an example, works better for them. And then we have our families that want as much live instruction as they can get virtually, which option A provides that mix of live in-person instruction with the Harrisburg School District teachers, and then the asynchronous model as well. So we've seen a lot of shifting back towards option A, pathway to classroom instruction, which I think is a positive. But also HVLA has definitely filled a need for our families in the community. We have about 368 currently enrolled in HVLA, and that's a program we didn't have just a few short months ago. So definitely that program has served a definite need within the community. But again, we're still doing enrollment. We're still working through device distribution. And then next week, we'll have more information on the partnership with Tri-County and the Comcast Essentials program, sponsored Essentials program initiative to help support families with access that, still need that support. So we've been finalizing, working with Comcast to get all the agreements in place. That was done, finalized at the end of last week. And now It takes 1 to 2 weeks to receive the codes from them that we can then start distributing. So there will be information coming out on Monday for our families regarding that program. And we also just want to remind families we have activated Wi-Fi access in all our parking lots during the day. So that is also something that is available for families that may have that need. And for those families that live right near our buildings, they'll probably be able to access that right from their home if they're right adjacent to any of our buildings. So I just wanted to remind our families of that.
No, that's great. I know we are talking about various internet options, and it does seem like there are a lot. The parking lot Wi-Fi is a good addition. The partnership with Tri-County is going to be a good addition. If parents want to find out more about that, more about the announcement which is coming up, what's the easiest way for them, and for members of the general community as well who maybe don't have school-age children?
Yeah, so we will push that out through all our social media platforms. We're also going to be doing a Connect Ed call to all our families. One thing that we do have active now, Mayor, is the Harrisburg School District app, and I'm trying to push that every chance I get. It is an app that is downloadable on Google, through Android and iPhone, Apple devices. It's a free app, and if a family has that app, anytime we push out information, no matter whether there's an issue with the accuracy of a phone number, we can still connect with our families through that app. So even if they, have to make a change in a phone, a device, as long as they download that app, we have that connectivity with them. And that's why we went this route. So again, encouraging our families to, if they have the chance, to please download that app, because again, it gives us instant connectivity with our families as information continues to evolve, because this continues and will continue to be a very fluid situation as we head into the start of the school year.
Absolutely. Download that app, and really best of luck for back to school and the start of the school year. Thank you for all that you're doing. Good to know the device distribution and everything else continues well, and that so many people have responded and signed up and registered. If you still need to register, it sounds like that's ongoing, even with the start of school on Monday. Is there anything else you'd like to add as a final word for the community?
No, I just want to say thank you in advance, because this is going to be all of us working together in very uncertain times. And, our teachers are very nervous. Many, some of them have never had to deliver instruction online. So I just, we all just need to work together. We need to support our families who are very nervous about what next week will bring. And I think as long as we stick together over the first 1 to 2 weeks, we'll work through some of the logistical issues that are bound to happen. This is not going to be a perfect start to the school year, but I'm confident over the next 1 to 2 weeks, we'll iron out any kinks, and we'll, right after Labor Day, things will settle in and we will be ready to go. And hopefully soon after that, we can start to look at the possibility of starting to bring small cohorts of students back in the buildings. Your information, Mayor, that you shared at the beginning of the show is very optimistic with what you're seeing with the BioBod testing. And I'm continuing to have dialogue with health professionals in the city of Harrisburg. That dialogue continues on a weekly basis. So I just want to let our families know we're continuing to monitor that situation on a week-by-week basis, and keeping my fingers crossed at some point soon we'll have an opportunity, even if it's small cohorts of students, to possibly get back to some in-person instruction. But it has to be safe. We have to make sure everything is organized and in place to do so.
Great. I couldn't agree more. And I know everyone's really appreciative of all the time and energy and thoughtfulness that is going into this this plan. And we will get back to, regular in-classroom instruction. It's only a matter of time, but we have to do it safely. So thank you for the updates. Thank you for joining us, Mr. Superintendent. And, we're going to go next to Public Safety Chair and City Councilwoman Asha Green. And Ms. Green, thank you so much for joining us on the show today. City Council just returned from a summer hiatus, but it really wasn't much of a break, certainly not for you and for many others, because I know you were out there at multiple town hall meetings, some virtual, some in person, talking about police reform, talking about some of the upcoming City Council legislative initiatives with regard to policing. So I thought we'd take a moment and maybe you could just give an update to the public about your reflections on those meetings, on those town halls, what you heard, and where then we can sort of get to where we think you're going to go from there. But let's start with it. I can say just personally, I had an opportunity to watch online, and as did a lot, and I was deeply impressed by, as I have been throughout this whole process, by the level of community engagement. You had great attendance. You had, dozens and scores of people at each of these town halls making very thoughtful and extensive comments. So as a publicly elected official, I'm sure you feel, as I do, sort of very inspired by the level of civic engagement. But what do you take away as the major lessons and takeaways from those town halls?
I think the major lessons, well, first of all, thank you, Mayor, for having me today. I'm glad to be able to join everyone here and have this discussion. Over the summer, we really just wanted to really engage the public and have the discussion about police reform, about Bill 8 specifically, which would form a Citizens Advisory Council. What we heard from the public, first of all, we heard a lot of passionate people. This is a topic that's really near and dear to a lot of people in the city of Harrisburg's heart, as well as people around the globe that are really looking for police reform. As we as a nation become more progressive, we need to see our policing, our public safety become more progressive as well. And the biggest takeaway I really took away from all of our town halls and just the public engagement, the community organizations that were having meetings, is that people really want to be involved in the process. They're looking for police accountability along with more police and community relations, but they really just want to be involved in the process. They want their voice to be heard. They want to help craft it. We have a very engaged public that doesn't want to sit back and just watch what's going on, but they want to take part in it to help craft what's going on in their city. So I think that was the biggest takeaway. And as a city council, we're making sure we're getting everyone's voice involved, including as much public input as we can. We just came back from our summer hiatus, and we will have the Bill 8 legislation will be up on not the next work session, but the following work session. So the second session, work session in September, we'll have Bill 8 on the agenda, and we'll be looking to make amendments right there on the floor to begin to craft the legislation based off the comments that we've heard from the public over the summer. We're also still accepting public comments via the public comment email address, via our personal email, our city email addresses, and reaching out to us any way possible. We're always looking to continue the conversation. And that's the best thing that we can do to really make for sure that the legislation is inclusive. We also heard from the public that they're looking for not just this piece of legislation that would create a police advisory or a police review board, but they're also looking for true police reform. They're looking for more mental health and domestic violence specialists. They're looking to ensure that public safety is more than just a police department, but an entire department that's going to help increase the safety in Harrisburg and the community relationships in Harrisburg to get the people what we need in order to be safe and have a safe city.
Yes, I heard those messages loud and clear, and it was encouraging to see so many people interested in being a part of the process. And I think you're right. Being a part of the process it's good for Harrisburg. It's good for it's really the way government should work. We need input from the public. Too often, city council's doing bills in quiet, or I'm presenting budgets without comment, and it's good to have so many people focused and really actively engaged. So you say that the next time really for public comment in an open work session is going to be at the second work session in September. And if people want to submit comments, what is the appropriate way for them to do that?
Submit it. I believe the email address is publiccomment@harrisburgpa.gov.
Okay.
They can submit comment via email. That's the best way to submit public comment. They can also attend one of our city council meetings, which are held every Tuesday, and they can submit public comment there as well.
Okay. And I know that you and your colleagues have been listening and absorbing lots of information, and I'm sure that there will be amendments made to the bill, and that nothing is decided yet, and that we're still part of a process. But in terms of a conclusion, I assume you hope to to pass something this year? Do you have any sense of a time frame? Obviously, you want to do it right, but what's the time frame in your mind for getting this board up and running? Because I've said publicly, and I think a lot of people agree, we need a board, and we want to start populating that board. We want to get the community involved, and we want to get it established. So timing.
Timing wise, it's going to be on the second work session in September. If we're able to get the amendments that we're looking for made, we'll allow for at least another work session for public comments. And then hopefully by the beginning or middle of November, we'll be able to get this legislation passed. And then we can begin forming the board itself. We've had people come down to the city and show interest on being on the board. So that's also very encouraging. And I'm ready to get that process started as well. But first, step one is to make the amendments that need to be made, and then look to get it passed sometime in October.
Okay, and again, I understand that really you're still developing your thoughts on the amendments. But are there any amendments that you see that you believe there are consensus for at this time that the public should expect to see? And maybe you don't have to go into exact detail, but what types of things are you looking to potentially bring up as amendments based on public comment?
Well, one of the biggest calls was for the board to have more powers. So I'll be working with the city solicitor to see what powers we can ensure the public has. I know that there was a push for subpoena powers. That's something we'll have to look into a little more to see what precedent's been set and what options are available to us, and see how we can really provide that accountability. There was the call to not have the chief on the board. I think that's something that everyone would be agreeable to. Just to make sure the board can be as independent as possible. There were calls about the trainings and orientations being conducted by the police department, and that's something we might be able to work into to see if a different department can hold the orientations instead, just to make sure the board is independent and able to make independent decisions. So I think those are some of the things that will be crafted into this legislation, but it's still in progress. It's still something we're working through.
Okay, well, thank you, Councilwoman Green, for those updates. Thank you for the thoughtful approach and the leadership. I have to say, on a personal level, you did a great job moderating those town halls, which was not easy, but you kept them flowing. You made sure that people were heard, and I'm confident we're going to end up with a good product in the end with your leadership. So thanks for joining us, and we're going to turn now to District Attorney for Dauphin County, Mr. Fran Chardo. And we're going to talk a little bit about one of those very initiatives which the public would like to see more of, and is constantly talking about when we have these town halls, which is basically in Dauphin County, we're calling it the co-responder program. But Mr. DA, can we talk a little bit about how this program came to be? And I understand that basically it was part of an initiative that began a few years ago called the Stepping Up Initiative. And I think Dauphin County deserves a lot of credit for taking the lead in foresightfully putting together a program like the co-responder program. So let's talk about the history. Welcome.
Thank you very much, Mayor. Yes, this goes back over 5 years ago. We started the Stepping Up Initiative, and credit goes to my predecessor, now Judge Marsico. He was chair of the Criminal Justice Advisory Board, which I had the privilege of now chairing, which is this board really brings all the stakeholders, not just law enforcement, but other social service agencies that really are impacted by crime and can make a difference. And we engaged an outside outfit to study the problem of mental illness and how it was affecting the criminal justice system. And it was the Stepping Up Initiative. And what this study found was that people with mental illness were more likely to spend time in prison, and a longer amount of time in prison, and that there were ways to prevent this. And these were people that really should get out of prison earlier and should be in the jail. And so the Stepping Up Initiative resulted in a number of reforms that we have in place today as a result. And one of them you mentioned is the co-responders that we have in place, and we're going to expand further. But that's just one piece of our approach. We have Dr. Ashley Yinger, who has a PhD, is our criminal justice programming administrator and stepping up certified CIT coordinator in the county. And she oversees this whole program. And one of the things that we do is we have crisis intervention team training, CIT training for police officers all over the county. CIT training really gives the tools that our co-responders have, and they help teach this training that they really have, but it gives a piece of that training to the patrol officers, so that when they come in contact with somebody who has mental illness, they know how to deal with them and how to engage them without laying hands on them, and to recognize the mental illness and to deal with it effectively. They had tremendous success. They're able to de-escalate these situations, and most of the time without it resulting in an arrest. The emphasis is on de-escalation. One of the other things that we have is our Team MISA, which is the Mental Illness Substance Abuse Program. And this brings together, again, all our stakeholders. We have an assistant DA who's assigned to it, identifies individuals, many of whom have mental illness, is the cause for their being involved in the criminal justice system. She has full authority to grab cases from other ADAs and to deal with them, oftentimes removing them from the criminal justice system altogether. Very effective. We're being smart on crime. And I say that all the time, that we're being smart on crime. We've been able to reduce our caseload so that we can focus in on the cases that we should be focusing on, the truly violent individuals that we're not going to cut a break to, the people that we should be focusing on, the truly violent repeat offenders, the people that are not doing these because of mental illness, the repeat offenders who are really victimizing our community. The co-responders are a key part of this program. And right now we have two co-responders. One of them is a part of our program. Elizabeth Manning is assigned permanently to the City of Harrisburg Bureau of Police. And we have another floater, Devin Lever, is in the townships, and we're going to get more co-responders as time goes on, so that we can have ones assigned to municipal police departments outside the City of Harrisburg. And this is a great initiative. It allows the co-responder to ride with the municipal police officers to aid them. Many of them have this training in de-escalation, but the co-responder is best equipped to do it, to de-escalate the situation involving individuals with mental health needs, to reduce the incidence of arrests, and to identify appropriate cases for the district attorney, when it's appropriate, to divert these cases away from the criminal justice system. They're not always going to be there. They're not always going to be in the car with the officer. So many times, and I know Captain Sorensen's going to talk about this, they can refer cases after the fact, and they get involved, and it's been a tremendous success, and we only hope to expand it further. And I know that we've gotten full buy-in from the police because they realize the value that these co-responders bring to the equation.
Thank you for that overview, and absolutely, and it's a great program. It's a program that's working, and it's a program that we absolutely want to be supportive of and expand. It's really a partnership between the DA's office, the sort of mental health component of the Department of Health, as well as the police departments themselves, and it sort of mixes training with embedding these co-responders right in the police force. And as you say, it's about sort of shepherding resources wisely so you can focus on the cases that matter and not have people end up in the system that maybe can avoid going into the system. But can you tell, since the DA's office has really been spearheading this and leading this effort, why is it important to you that that we do this and we do this now?
Well, we've reduced the time that individuals with mental illness are staying in the jail and they didn't belong in the jail. We've gotten to the place where they could get the help that they needed. Before, people with mental illness were spending far longer in the jail than people without mental illness. And now it's just the opposite. So we've identified people that should get out of the jail and get help. That's been tremendous. And as a result, we've reduced our prison population a great deal. We've also reduced our caseload in Dauphin County, the number of dockets that we have, so that, as I say, we can be smart on crime and focus on the cases that need the focus, the most violent individuals, the ones that we need to focus on.
That's great. Thank you. Let me turn now to Catherine Kilgore, who is the CJAB administrator for Dauphin County. And Catherine, maybe in a larger overview sense, you could talk a little bit about, what is this CIT training? We've heard time and time again from the public that they want to see more training. They want to see greater de-escalation. Walk us through what's going on in these CIT sessions.
Yes, thank you for having me today. And in CIT, it stands for the Crisis Intervention Training. It's based on the Memphis model. And essentially, it's a 40-hour week-long session where attendees will learn about any number of mental health diagnoses. They'll learn about folks on the autism spectrum. You'll hear from Area Agency on Aging. You'll do role play engaged with actors who will, at the end of the training, bring folks into the experience of, okay, how do you de-escalate, practicing those skills. So it's a very intensive session. It's 5 full work days. We've had a great deal of commitment from the departments to take part in this initiative. And as we were getting started in our county, we actually received a grant from support of the PA Commission on Crime and Delinquency to help us move these trainings forward. And at this point, we've had 3 of these 40-hour sessions. We have in Dauphin County 76 people and 49 police officers currently trained in this model, dispersed through any number of departments. In Harrisburg City alone, there are 22 police officers who are CIT trained. And that is important because as we talk further about the co-responders, and we'll hear later from them in more detail some of what they do each day, it's important to have a cadre of folks, because when that call comes into emergency management, they can then possibly call on an officer who has that experience and understanding of how to interact with someone, de-escalate that situation, and hopefully bring about a safer resolution for everyone involved. So that's really the crux of crisis training. It is focused on de-escalation, the mental health diagnoses, and even some of the programs we have in the county, such as our treatment court programs and some of these other initiatives such as MISA, where we've really focused on, as a result of stepping up, the front end of the system and trying to find ways to better identify and divert populations as appropriate.
So the training, and we'll talk to a few that have gone through it here in just a minute, but the training sounds so important. I can hear people sort of listening to this and saying, well, why isn't everyone being trained, and why haven't we ramped this up even further? And I understand that with the current pandemic and COVID-19, that's affected the ability for people to gather and do training classes. But let's talk about where we're going as a program. Do you think we have the ability to really expand what we're doing and to grow this throughout Dauphin County in the years to come?
Yes, I do. I think the commitment from the county and other stakeholders is strong. Ideally, when you look at different research out there, they recommend about 20 to 25% of all officers in an area being trained, but sometimes it's just within a certain number of departments, making sure that there are enough available, like I said, to be available and to handle some of these calls. So I think the commitment is there from everyone to expand this training. We are scheduling these as we can. COVID did throw a wrench. We did have to cancel one and readjust it. We just held that training. And Dr. Yinger is to be credited with the implementation of this. Working, our chiefs of police association and other officers have all bought into this. They were actively engaged as we were going through the Stepping Up initiative, really took a hands-on role about telling us what they think they need, and also, as we were coming back with data, being able to say, okay, this is what the report is showing. Let's work together and keep moving forward. And they were very committed years ago to engage in these initiatives. So I've seen the commitment from the police. We are hosting the trainings as often as we can, and there are definitely more discussions to keep this moving forward so that we train a large number of officers. I believe the number I saw a few years ago in Dauphin County, we have at least 400 law enforcement officers. So with 76 right now, total people trained, about 50 officers. We still have a long way to go to grow that number, one step at a time, and we are committed to continuing.
That's great to hear. And the city of Harrisburg is committed to being a partner and putting financial resources behind it if that's what needed to sort of expand this. Let's turn now to Captain Sorensen, and maybe Captain, I know that you yourself have gone through this training and really believe in its value and importance. Maybe you could talk just generally about what you learned. Here you're a seasoned police officer with decades on the job, enormous experience, and yet even you, I think, had your eyes opened and learned important things by going through this training.
I did, and thank you for having me on the show, Mayor. When I first heard about CIT, we at the Harrisburg Police, we're as committed as we are to helping the citizens. One thing we really need is when you go out there and you look for a real de-escalation training. When I first heard about CIT, they put out what it was all about. It looked very interesting. So I was part of the inaugural class, and we had quite a bit of Harrisburg police officers there. And it really, I've been here since 1992, and it opened my eyes to the benefits of the program. Just to go out there, and they trained us not only on how to deal with people who are having a crisis, a break, or whatever issue they're having at that time, to recognize, what they're going through, how we can best react to it, and then how do we refer them to the services? And that was a large portion of the beginning of the program, was just that. What services are available in Dauphin County, and there are a lot. They had program heads come in and explain to us what resources are available, where they're at, the availability of them, the training and the recognition of someone going through a mental crisis at the time, and then how to best refer them. And one of our goals there is, as we go there and learn how we can better respond to someone who's having a situation, is that once we deal with that, we may not have to go back to that address over and over and over again. So what we did in the Harrisburg Police, at least, was we sent people and officers to the initial training. And as the classes progressed on, when I came back, I felt right away that this is the best de-escalation training I'd received in my entire career. And I let that be known to Commissioner Carter, the Deputy Chief Moody, and said, I feel like this is where we have to go as a bureau to better serve the citizens of Harrisburg or whoever we encounter in the city. So there's less violence in our response. We have a better recognition. We can deal with the issues we see. But part of that was to get officers trained up so we're ready to accept the help of a co-responder if that ever came to fruition. And it did. We were very grateful to D.H. Chardo and getting a dedicated co-responder and the Dauphin County Commissioners, Mr. Chardo, to getting someone here at Harrisburg where there is a real need. 3 shifts, 24 hours a day, the officers would go out there encountering individuals, and having Liz as part of our team has made a huge difference for us in Harrisburg.
That's great to hear. And as the head of our Uniform Patrol Division, would you say that the co-responders have been embraced by the average officer, the average patrol officer? What has been the reaction to Liz Manning, and we'll get her perspective in a moment. But from the patrol divisions themselves.
Well, I'll tell you what, Mayor, we're very lucky in Harrisburg to have Liz assigned to us. She is a breath of fresh air. She has a huge resume of a varied background that really benefits us. You have to understand that she attends roll calls with the officers. She rides into cars with them, whether they're CI trained or not, CIT trained or not. She goes on the calls when the mental health nexus of a call is realized by an officer or our Dauphin County dispatchers. They make sure that she gets to that scene. She is a primary responder to go there. But if she's working on another call and there's another mental health call, we have CIT officers who can go out and handle that and then call her there. She's very busy. She's been a great asset, and we're blessed to have her here in the city, Mayor.
Well, thank you, Captain. I think that's a great introduction. We're going to turn now to co-responder Elizabeth Manning, who has joined us. And Ms. Manning, what was it like for you, the initial transition, becoming embedded with the Harrisburg Police Department? We've talked a lot about what you've brought and the things that you're doing. But how was it like basically when we tried something new here in Harrisburg?
It was a great experience actually for me. The guys were, and women, were very accepting of me when I came in. It was a breath of fresh air to actually see that it was a smooth transition. Everybody, all the officers welcomed the help and started getting to realize what was going on. And you could tell as it went on, they would then themselves recognize it, the mental health piece, before I would. Before I could get there, they would call me and have me come to the scene.
Yeah, we've talked a little bit, but tell the public, how do you get called to the scene? What calls get brought to your attention? And when you arrive on the scene, how does that maybe change the dynamic in terms of what existed prior to a mental health professional arriving?
So what happens is I'm riding along in the police car all day for most of my shift. Except for roll calls. And the officer that I'm with I will look at this screen to see if there are any. If we're on scene at another one and another officer recognizes that I'm needed a different scene, they'll radio us and then we will head over as soon as we wrap up the call that we're on.
Mm-hmm. And sure. And what happens when you arrive on scene? Give us some general examples.
When I arrive on the scene, sometimes it depends on the situation, on how intense it is. A lot of times they'll have the person already calm and sitting there and it's talking to them till I can arrive. When I get there, it's assessing the person, their needs, what level of treatment they would benefit from, and then talking to the person about the different avenues that they could go to receive help. I've even gotten calls where they recognize that somebody was in the middle of maybe just a criminal trespass or something, and they recognize the mental health, and it was trying to find an avenue not to have them get caught up in the system, as opposed to find the help that they need because maybe they were off their meds and didn't understand what was going on in the situation. So I help facilitate.
Right. What does it mean to find them the help that they need? So you're on call. You've determined that this person would benefit from a service which is out there. We would benefit in general by not putting this system through the person through the criminal justice system. So what happens at that point?
A lot of times, if they do not have a case manager, I refer them to CMU so that they can get case manager services for a further ongoing. Because while I do help them for as long as I can, some of them will benefit from case management to help with the linkage of services. I give them options of whether it's mental health treatment, whether like one of our outpatient providers, or for a drug and alcohol people, if they need drug and alcohol, trying to get them into a rehab, or if they need that level, or just give them the outpatient provider. So it's linking them up with the services that we have. A lot of times I'll sit there and call with them just so that they feel comfortable and we can actually make sure that they do get linked up and start up the treatment.
And there's follow up too, right? I mean, it's not just at that moment when you're called to the scene. What happens after that moment?
Afterwards, if they have case management, I usually try to follow up with the person or the case manager, or if they don't, I just try to follow up with the person to make sure that they're still doing okay. Usually it's a phone call with COVID going on, but down the road it could be going to the house. Sometimes there's even follow up. Because I do not work 24/7, there will be a call at night, and then I will follow up in person, usually the next day, to try to help the person out.
Sure. So can you give a sense to the folks that are watching? And I think this is a wonderful program. It's a program that obviously everyone who's involved in it sees the benefit, and it's something which the public wants to see and maybe doesn't even realize is occurring on a daily basis. But can you give us a sense of the need that is out there and the sort of constraints that are on your job? I mean, how busy are you, and how continuous is the pressure, and are we diverting as many people as we should from the criminal justice system through this program?
I can tell you that there's a lot of pressure on this job, especially with the population that we work with. And I'm not sure if it's COVID that amped up the numbers, but we have been having an increased amount of calls, increased amount of issues where people need to go inpatient, and we're helping with that transition. So we have it set up that the officers and I work very well together. I've been blessed with the department that I've received and the dedication of the officers. They will also, if I'm not there, have reached out and called me. I'm available to them via phone anytime. We'll walk through it that way. It would benefit to have more people involved as far as that. And I know that is working coming down the line to get another person for this department, as we do have a higher number of calls than originally anticipated.
Well, thank you. And I can just say from the city standpoint, this is something that we're interested in funding in partnership with the county, and making sure that we expand and get you the support that you need, and get our police the support that they need to be able to do what they do. I think it's important the public understand the program exists and sees the benefit, and understands as well the amount of treatment opportunities that are out there, and that a large part is just connecting people to the right places and the right entities, and that's something that we can do moving forward. So thank you for your work, and I'm going to turn to you, Momin, and I imagine we probably have some questions. We've covered a lot of ground, and we've got the guests to answer them. So go ahead.
Yes, thank you, Mayor. Thank you to everyone that's joined us. First question is for the Mr. DA, Mr. Charter. Are there plans in the near future for co-responders in other municipalities? You had mentioned that there was a plan, but do you have any more details that you can share?
We're working on funding additional co-responders. Right now, we have one floater between Susquehanna Township, Lower Paxton Township, and Swatara Township. And we're going to add, we hope in the near future, at least one more. The plan in the long term is to get many more, but that's going to take some time. But I think that in the relative near future, we'll add at least one, and we'll take it one step at a time.
Okay, great. Next one again, Mr. Chardo, about the mental health. You had mentioned about those persons with mental health issues. There's reduced times, or in a lot of times prevented measures instead of them going to prisons, that there's other help and resources available to them. Can you describe those partnerships and relationships you have with different organizations to get them the help they need?
Sure. Well, so the Team MISA, the Mental Illness Substance Abuse program, they'll look at each individual case, and every case is different, to see what the needs are of that individual and whether or not they would benefit from a particular plan. It also is going to depend on the case. For instance, if it's a case where there was some violence, well, that's going to be a different story. If it's a misdemeanor case of violence, well, we might be able to work with that outside the prison context. If it's a really, really serious violent case, well, then that's less viable. So there's the devil's in the details, I guess, is the answer. We're going to look at the options that the science, that the medical professionals provide us, the psychiatrists, the psychologists, and then we're going to look at the details of the case to see what the right thing to do is.
All right, great, thank you. Next question is for Ms. Kilgore. Regarding the administrating of training, have you noticed any changes that needed to happen during the course of that training? Maybe more attention to certain aspects and less attention to other things?
I believe that has varied by class. Dr. Unger is the facilitator for these, and again, she was unfortunately unable to join us today. But as the first curriculum and the first agenda was set out for the CIT training, there are specific items that need to be included, and I think maybe some time has been allotted, more maybe to like some cultural competency, more to understanding what a 302 process is. I think it's varied a bit by class. Some of that has to do with the number of questions folks are asking. Some of it has to do maybe something else emerged and we need to train on additional topic. Generally speaking, I think since the first session, there haven't, once the second one came about, I don't believe there have been any major adjustments. The speakers have been outstanding. Everyone has been consistent in being able to attend. We've had folks from the community speak. So there are actual individuals that have received mental health treatment that tell their stories to attendees in the class. Essentially, the structure has remained the same, but class to class, there might be more questions on certain areas. I know the role playing, the feedback I've read from the officers, there's a pre and post test that is given, and every single class that is done, there's always a positive outcome, meaning everyone attending feels like they understand the services available, what these treatment needs are. They understand in the community how that might come out better than they did before. And the role-playing piece at the very end, which allows each attendee to practice what they've learned during the week, that is always extremely popular. I think people might enjoy doing that even more. It is a 40-hour training already. It's something that, probably people could practice, many, many times. But I think that's something that people really like to do.
Okay, great.
Moment, if I could jump in, Ms. Kilgore mentioned the 302 process, and it might be helpful to have Captain Sorensen talk briefly about what that is and how that works. Captain Sorensen, could you talk a little bit about the 302 process?
Yes, sir, I can. A 302 is a situation where someone having a mental illness who is going through a crisis or is suicidal or is unable to take care of themselves, that has to be recognized by a family member, a crisis worker, or a law enforcement officer. And then that person, a law enforcement officer, if they view these things personally, they can say that Mr. or Mrs. X is a danger to themselves or others, and the ability to take them to the hospital, whether they want to go or not, and get them seen by an emergency room doctor or a physician, where they can make a determination on whether or not they're going to keep them in a facility or in a medical environment, so they can determine what is going on with them and get them the help that they need. A family member can also go sign there where they petition crisis intervention, and then the 302 is signed off, and then Liz and her teammates go out there and they find that individual, get them down to the hospital to be seen by a doctor, if that helps.
It does. I thought that was important to let people know.
And that's actually a great segue to the one more question that we have time for. This I'll toss to Ms. Manning. Do you have any tips for the public if they encounter a situation that may be mental health related, perhaps before you or other officers get there? What can they do if they see something like that? And Ms. Manning, I believe you're on mute.
Sorry, I'm sorry, I'm having trouble hearing. Can you repeat that question?
Sure. The question is, do you have any tips for the public if they encounter a situation that may be mental health related, perhaps before an officer or yourself arrives on the scene?
I do have a couple of tips that would be helpful because often we do not know that somebody has mental health. There's been a bunch of times where we've arrived and it turns out if a caller is calling in to dispatch and asking for officer assistance or my assistance, giving a brief rundown of maybe what the diagnosis is, the behaviors, weapons involved. These are all things that are good for us to know when we show up so that we can kind of adjust our approach to how we respond to the situation. And when I say that, like, if we know that there's certain issues going on with them, we can use that and try to talk to them about that and more streamline the process. And then it usually helps in the end with de-escalating the person verbally.
Okay, thank you very much.
And can I add? So if a call is flagged as mental health from the start, does that get to you faster than? Are there certain words that the public can use when calling something in that would be helpful from a call routing perspective for the police? Maybe I'll take that. Go ahead. Yep.
Yeah, I was gonna say yes. In my opinion, I mean, Captain can answer for this too. In my opinion, it does help route it faster because when the officer that I'm with for the day and I are out, we're watching and monitoring the calls. So if we see something, like we'll look at the notes and we see that it's flagged mental health, it can get to us faster. Also, dispatch would have the opportunity to call myself or one of the CIT officers out instead, knowing that there's like mental health, intellectual disabilities, whatever the case may be, involved, so that we have that approach down.
Yeah, and Captain Sorensen, maybe you could just address it. Tips for the public in terms of calling in if they're observing this type of behavior that they might see as rooted in mental health issues.
Well, Mayor, I think Liz hit the nail on the head there. Is like anytime you have to call the police or ask for help from 911 to get police, fire, EMS, there is just try and give as much information as you can. You know, what are you seeing? What is the individual saying? You know, what behaviors are they exhibiting? But if you know that maybe you're calling on me and you say, Dennis Sorensen is bipolar. He's going through a mood swing right now. He has not been taking his medication. All that is very helpful so it puts that, and it, you know, that if you know the individual and you can provide that insight prior to the police getting there with a co-responder, then we're better able to quickly make an assessment. As we've got credible information from someone who knows the person, and that can help us. If we know what kind of medications they're on, you may not know the what diagnosis they have, but just tell us what you're seeing and what you're hearing to help us get a right frame of mind before we get there. And hopefully that's accurate. So when we get there, we can deal with it more appropriately. It would lessen the amount of time we have to assess it ourselves if someone who knows about an individual can give us some background.
That's great. Thank you. That's great advice for the public. And I know so many people are out there asking what can they do? How can they help improve these types of interactions? And more information is always helpful, especially when the initial calls are being called in. So with that, I want to say thank you to all of the guests for coming today. I think we had a great conversation about a very important program and a very important topic. And we will be continuing as we move forward in the weeks and months to come to focus on issues of policing, issues of institutional racism, and the topics of the day. But we're going to take a brief departure next week, and we're going to talk about Capona and the start of the school year and the end of summer and the beginning of fall, all those things occurring. And we're going to take a moment to talk about an opportunity for the public to come together in a positive way and celebrate safely in the city. So join us next week. We should have some vendors and guests and others that'll talk about what Capona will be like this year. And until then, this is Mayor Eric Papenfuss saying thanks for watching, and we'll see you next week on Community Conversations right here on Facebook Live.